The World Health Organization has declared the Ebola outbreak in the northeast of the Democratic Republic of Congo a public health emergency of international concern. Now, that designation is reserved for diseases that have a very high risk of spreading to neighboring countries. The health experts have already detected the disease in neighboring Uganda. There were two cases that were reported. One person has already died, and that has raised a lot of fear among the neighboring countries. The DRC shares borders with 9 countries, and we have heard that there have been a series of meetings between the World Health Organization, Africa Centers for Disease Control, and these neighboring countries like Uganda, Rwanda, Burundi, Tanzania to strengthen surveillance, step up border controls, and ensure that they share information about travelers who are coming from one country to another. And we have heard that these countries have already sent health teams to their border, checking people, especially those coming from the Democratic Republic of Congo, to prevent the chain of transmission, the disease from spreading from one country to another. We've heard that Rwanda has already shut its border in eastern DRC with the Congolese authorities because they're fearing that this disease is quite fatal and it might affect their population over there. This outbreak has happened in an area that has been grappling with conflict for more than 5 years. Ituri province has a number of rebel groups like Codeco, ADF, Zaire, that have been fighting over land, political power, and minerals. That is a region that is very rich in gold. And the rebel groups have been fighting over these minerals, and that has created a very big problem for health officials who are trying to tackle this disease because there have been attacks on civilians. The civilians are forced to flee their homes. They go and stay in displaced camps where they're crowded, and this provides perfect conditions for the spread of infectious diseases. So the government has been having meetings with the security officers in the country and health experts to try and see how they can overcome this very big challenge. And also the mobility of people going from DRC to neighboring countries is a big problem. And so they're working together to ensure that they bring this disease to an end. Chris Sochamringa, Scripps News, Kinshasa.